Welcome back, faithful politics listeners. I am your political host, Will Wright, and Josh is off once again. He's off trying to be John Malkovich, but hopefully he'll be back next week. But thankfully, we have instead someone who is not John Malkovich. It is Dr. Danny Avula. I should have clarified that. Is it Avula?
Avula's right. Oh, yeah.
Okay, all right, and he's Virginia State Vaccination Coordinator, and as the Richmond Times said in one of their articles, that he's the Dr. Fauci of Virginia. Although I would say maybe Dr. Fauci is the NIH of Danny Avula. I don't know. Welcome, Dr. Avula.
Thanks, Will. Great to be here. I actually got the chance to be on a webinar with Dr. Fauci recently, and I shared this story because I had been spending a lot of time over the last year and a half in the media, on TV, on radio, and I was at the library a few weeks ago and I was in my car backing out. A woman started waving me down. She runs towards the car, and I'd left my coffee mug on top of the car. And as she hands me my coffee mug, she says, "You look really familiar. Are you Dr. Fauci?" It was hilarious. And so I got to tell Dr. Fauci that story, which was one of the highlights of my COVID experience.
That's hilarious. You should have said yes. And then when she sees him on TV, be like, "That's an imposter. I met Dr. Fauci." Oh, that's awesome. So what do you do, I guess, like for Virginia and kind of the whole COVID response and everything?
Sure. So, prior to January of 2021, I was serving in my role as the local public health director for the city of Richmond and the county of Henrico. And what the local public health department does, kind of outside of COVID, we have all kinds of things we're engaged with, looking at the way that different communities, how are they healthy, or how do we help them be healthier? There's a lot of educational efforts, but then communicable disease is a huge part of what we do as well. And so when there are localized outbreaks, like a norovirus outbreak from a restaurant or a flu outbreak in a nursing home, it's our team, our epidemiologists and our contact tracers that go in there and try to contain that disease. So that has been completely ramped up on steroids in the midst of COVID. We added about 150 new staff during 2020 to really build the contact tracing and case investigation teams to really get after every case, every new positive, and to really do a full case investigation and contact tracing on those. So, our role as a local health department through most of 2020 was trying to help people make sense of what's going on with COVID, trying to help them understand, what is this virus? How is it transmitted? What do we do to prevent it? And what kinds of changes do we need to make? Wearing masks, social distancing, should we shut down the workplace? All that kind of stuff. And that was a bulk of our work in 2020. We really shifted to almost 100% COVID focus. In January of 21, the governor reached out and asked me to come and join the state effort and to really help coordinate the vaccine rollout at the state level. So since January, I played a very different role with a statewide lens, actually helping execute the operations of the vaccine rollout. And so that's been just an incredible endeavor over the last 7 months or so. And now I'm starting to kind of float back into my local public health role, but I've got a foot in both worlds. So a pretty comprehensive perspective, at least on COVID in Virginia.
Yeah. And Virginia was one of the first states to actually roll out an emergency temporary standard for COVID, which I thought was pretty phenomenal. And I'd love to kind of get your take on how did, if you were part of that, and how much of an effect do you think it actually had on businesses in Virginia?
So I was not a part of the creation of that. That happened in July of 2020, and really in the midst of COVID unfolding, and after kind of the second wave of disease last summer. I certainly was a part of enforcing that and helping translate it for a lot of our partners. So I think to your question about what difference that it make, maybe first I would say that this emergency standard really kind of hones in on one of the core hot button issues in public health, which is what do we encourage and what do we legislate? What do we mandate? And I think, there's a lot of sort of philosophical approaches to that question, and it also gets to some of our core beliefs about individual rights versus protecting the public good or protecting the community at large, and so all of these things, like throughout COVID, have just come into have butted heads. And so I think the emergency standard, particularly where we were last year, watching places like New York and Chicago, where their healthcare systems were just completely overwhelmed, that was something we had to pay attention to. And so I really tip my hat to the governor and the team at the state who said, you know what, we really have to get more serious about figuring out how to use every tool we can to prevent the spread of this disease. It was very difficult to actually enforce a lot of that. And some of that fell to our folks at the local level. I can't tell you how many calls we were getting from a store owner or a restaurant or a patron who said, hey, this restaurant isn't complying by the emergency standards. And then our health department teams in many cases had to go out and to try to document evidence or to try to talk to the store manager about how to enforce these. And it just, they were very difficult times. And so I think it made a difference, but it wasn't without its challenge.
Yeah. What's been one of the biggest hurdles you think you've had to overcome with the pandemic?
Well, I would look really to the last 7-8 months of the vaccine rollout. And, early on, the biggest hurdle was that we did not have a lot of the tools we needed to effectively get vaccine to 8.5 million people. And when I say tools, I'm talking about things like a registration system that works and is easily accessible for everybody, a centralized call center that could handle the kind of volume that this was going to generate. I mean, the reality is that we've just never faced any threat that has impacted Virginia or the country or the world on this scale, and nobody was prepared for that. And so that was one of the early challenges, is figuring out how do you build up that infrastructure, the communications infrastructure, the support, the way to help people know if they're eligible to get vaccinated, and if so, how do they get access to it? So that was an extraordinary challenge. I think the other, probably the most acute part of that was January, February, and a little bit of March, where our vaccine supply was nowhere near enough to meet the demand. And so really having to figure out, how do you parse out a very scarce resource and justify it with a risk categorization, and then deal with just the angst and the frenzy that people would go through as they contemplated their own risk level and their fear about this impending virus. And so those were really difficult months, because part of my role as the state vaccination coordinator was to update lots of different constituents and try to help them understand where we were at, what we were doing to try to help increase access to vaccine, and why some people really should wait until the most vulnerable among us could get access to it first.
Wow. Now there's 3 vaccines that are available, right? So there's Pfizer, Moderna, and Johnson & Johnson. And I mean, I'm fortunate. I'm team Pfizer. Here's the back of my card. I'm not showing you guys the front, but can you explain like what the differences are between the 3?
Yeah, so the first 2, the Pfizer and Moderna, are very similar vaccines, and they were built on a platform called the mRNA, messenger RNA platform. And it's a platform that we have been evolving, the public health and healthcare institution at large, since really the late 1990s. And so they've tried a lot of different vaccine attempts on this mRNA platform. Most recently, there were some efforts around the Ebola virus and a couple of others in recent years. But this is the first time that it really took, that they were able to load up this COVID virus onto the mRNA platform and create a vehicle to get just the spike protein, the genetic material that codes for the spike. So everybody's seen the coronavirus particle, which is that ball with all the spikes on it. So what the mRNA platform does is it delivers a little bit of genetic code. Your cells read it, they make this spike protein, and then your immune system responds to that spike protein by developing antibodies. And really, it's remarkable how effective that mRNA platform has been for this particular virus. The Johnson & Johnson vaccine is built on a slightly different platform. It's called an adenovirus vector. Adenovirus is one of the very commonly occurring cold viruses that we see every year. So what they did is they took the empty shell called the capsid of an adenovirus, put some of that genetic material from the COVID virus into it, insert that into the body, and then your immune system similarly sees that genetic material and develops an immune response against it. So same concept, you're triggering your immune system to recognize this invader, rev up its defenses, and be able to recognize it if it were to show up again.
Got it. So when you say, so the Johnson & Johnson, you said that like they take like not COVID itself, but they do, it's something inside the shell you're talking about.
Right. So they took some of the genetic material of COVID and they put it in the shell of another killed virus. So adenovirus, the reason it's called the adenovirus vector is because they use the outer shell of an adenovirus just to get it into the body, but it's the COVID spike protein that it codes for. So again, similar concept, it's using genetic material from the COVID virus, but in any of those cases, nobody is injecting the COVID virus into your body.
Got it. Now, what about microchips? Are they injecting microchips in us? I know the answer to that. I'm just curious.
No, obviously that question has come up a lot, and I really don't know the origins of that. But I do think it aligns with this overarching sense that there's something, some kind of foul play with COVID from the beginning. Like, what is this virus? Where did it come from? Why are we all getting it? Is it real? And then that thread just continued through vaccination. And so all of these things like, is there a microchip or does it cause you to be magnetic? I mean, so many different things circulating on social media, but absolutely there's no way that the microchips could be small enough to even fit in that vaccine. I think it is one of the more outlandish myths, but there's been a lot of different things that people have brought up to try to dissuade people from getting this vaccine and even believing that this virus is a real thing.
Yeah, that is really crazy. Now, if with the prevalence of vaccine hesitancy in this country, is there another option to get us out of the pandemic, or is vaccines really it?
Yeah, I think both on the domestic and global scale, vaccines are absolutely going to be needed to get us out of this pandemic. Now, if we let the virus take its course, it's possible that we get to some degree of herd immunity or whatever that means. The meaning of that has evolved as this pandemic has evolved, but it's possible that the virus and its present and future variants get through enough of the population that it kind of peters out over time. But it's not going to do it without great cost to life, great cost to the healthcare system in terms of hospitalizations. And so clearly the best way, the preferred way, the safest way for us to get out of this pandemic is to get as many people vaccinated as possible.
Got it. Do you find vaccine hesitancy to be limited to a particular age group, particular ethnic group? What are you seeing as like the biggest areas demographic of people that are being hesitant to take the vaccine?
Yeah, they're really different camps. Well, there are a lot of different people who, for their own reasons, don't trust this vaccine. So let's take white evangelicals as one category. Over time, they have been probably the largest group that has had the lowest rates of vaccination. And a lot of that hesitancy, and I've spent a lot of time doing focus groups with pastors around the state, I talking to folks in my own church and my own community, and that people really do have this sense that COVID is not real, that it was manufactured by the government, that it is a hoax, that the vaccine is really sort of embedded so much in big pharma that, hearing the government get in bed with big pharma, they're trying to make me do something that I don't want to do, and I don't want to let these companies get rich off of me. So I think the core of that is really this distrust of government and a resistance to government telling you what you should do. So there's that camp. I think in the African-American community, so I live in a predominantly African-American neighborhood. I have a Black daughter, she's adopted, and she's very much plugged into the African-American community. And a lot of our work in public health has been working with the African-American community around other, previous vaccine hesitancy to the flu vaccine, as an example. And that is rooted in kind of a different set of skepticism. This country has not been kind to Black people historically, and particularly institutional governmental public health, right? There are so many examples of forced sterilization, of surgical experimentation, of, the Tuskegee experiment is probably the best known, but, it's one of many, many, many efforts to devalue the humanity of Black people. And so that has resulted in a pretty understandable and justified skepticism about what the government's trying to tell you what to do, especially when it relates to health. So that is rampant in the Black community, and I would say more strongly in the young Black community than the older Black community. And I'll talk about that in a second. And then the third camp, I think, is just young people writ large. Like, young people feel like, hey, COVID isn't really causing severe disease. I don't want to put that into my body. I don't know enough about it. But if I got COVID anyway, it's not that big a deal, because young people aren't really getting severe disease. And then one other interesting thing that has come up in survey data is that when young people are asked, like, who do you look to for information, where do you go for credible sources around COVID, the number one answer is themselves, right? They don't trust necessarily a doctor or somebody else. So like the sources of information just are really challenging to infiltrate. But I want to come back to that differentiation I mentioned between the elderly in the Black community and the younger folks in the Black community. Early on in this pandemic, and really even now that we're seeing this next surge with Delta, this virus has created massive disparities in health outcomes related to COVID. And so early on, we just saw really disproportionate rates of hospitalization and death happening in the Black community and the Latino community. And I just know, like, talking to my own neighbors and my own friends, that COVID, like, the impact of COVID was way more proximate for my Black neighbors and friends. Like, they had people in their families or their church congregations, or that were just very close to them, that were either hospitalized or had died. And so the way that the Black community responded to COVID it just felt very different than folks in other communities. And that proximity, I think, led to a really high uptake in the elderly Black community, because they just seen the impact of it firsthand.
Wow, so with the vaccines, and especially in Virginia. So you and I both live in Virginia. Virginia just got a huge influx of Afghanistan refugees. How does that work with, like, the supply chain? Like, does the federal government have, like, their own stash, or does Virginia, give them the vaccines? Or I'm just curious. This isn't really necessarily a question from a listener.
Yeah.
That's just something I was thinking about.
Both of those things are true. I mean, the way that this whole rollout has been working is that the federal government has contracts with manufacturers. They then do the doling out of vaccine. And so each state gets a certain amount that they can order down a week. And this was only relevant up till about end of April, early May, because at that point, the demand started to drop off and the production really, really caught up. So really at this point, we could order down as much as we needed.
Mm.
And the state health department would then order that down, and we would distribute or have, we would approve providers, so pharmacies, doctors' offices, health departments, hospitals, who wanted to get direct shipments of that vaccine. So all of that ordering was happening through the state, pulling down vaccine from the federal level. The federal government also has, a supply of vaccine that it would ship directly to pharmacies or to federal outposts, so like military bases, the VA hospital, Department of Defense employees, and they were doing a lot of that vaccination directly. So as it relates to the 24,000 or so Afghani refugees who have been coming into Virginia, it's a joint effort, and the local health departments, who are actually part of the state infrastructure, are up. They're doing screening, they're doing testing, they're doing vaccination, and so it's a bit of a combo effort between the states and the feds.
Got it. Now, I want to circle back to what you were saying about, kind of the church and the vaccine hesitancy. I don't know what faith you are. Feel free to let me know if you feel so inclined. But I'm curious, like, what would you say to somebody in a church or your church if they say, I'm not going to get the vaccine, my God will protect me, or what have you? Like, what would you say to that person?
Yeah. So I certainly consider myself a Christian. I've been a part of a Protestant church for most of my adult life, and worship here at a Presbyterian church here in Richmond. And this has come up a lot, certainly with individuals in our community, but also with patients. I still do a little bit of clinical work, and I remember very vividly a few months ago, talking to the parent. I'm a pediatrician, so I was talking to the parent of one of my patients, and she said, I don't want to get vaccinated. God will protect me. And that has been a very consistent theme through faith communities, is the sense that this threat is something that's not bigger than God, right? God can absolutely vanquish this threat. And I think my answer generally is that I absolutely believe that God is bigger than this threat. I also believe that God uses tools like science to help us. And you point to medicines, and you point to sort of the entire industry of healthcare, and then even things like seatbelts, right? I mean, there are just very practical things that medicine and industry have evolved that that we trust are part of God's plan to keep us safe, or to help us prosper. And for some reason, this particular virus and the vaccination effort behind it has just been such a flashpoint in faith communities that people sort of hold on to this almost fundamentalism in a different way than we've seen with a lot of other health issues.
Yeah, it's kind of weird. It's almost like, I mean, I don't envy the role that you're in, only because as a Christian and as a person that is in charge of the vaccination effort in Virginia, like I could only imagine people considering you to just be like this instrument of the devil, or something. in the sense of, you're trying to push these vaccines into my vein, and I don't know if you get any of that, and I really hope you don't. But as a person that pushes for vaccines, I mean, I would think that a Christian or a believer would say, look, like, I'm a believer, I think you should get the vaccine. So how does that fit into, your particular context of why God's telling you not to get the vaccine? Because I'm imagining Christians and all different and other kinds of faiths like played a role in the development of the vaccine, right?
Absolutely. Yeah. I mean, I just think fundamentally God uses science, right? God created us as beings who have brains that are thinking of and doing this amazing research. And so I think the question for me has been, why has that been uncoupled from the hand of God? Like, why is all of a sudden science, advancement, medicine, treatment, like how has that been put in this category of not of God? And again, the larger context around this virus and just where this country is right now, I think all of that has played into that a fair amount. And to your earlier question, like I have gotten a lot of that. I'm not on social media very much, but my daughter is and my wife is, and so every once in a while they'll be like, "Did you see this one?"
Oh
and
my.
you know, I think there's been some pretty hard stuff, and I've also gotten letters sent to my office, and certainly my staff have as well. And you know, I think it's been a very emotional, just the last year and a half has like struck a lot of emotional chords for our population, and so people often fill my inbox and my mailbox with the way that they're feeling about that.
Wow. Now, are these like handwritten letters or are
I've
these
got yes,
like typed?
a little bit of both. I've gotten both handwritten hate mail and hate mail.
Oh my gosh, I can't even remember the last time I wrote an actual like. I
You
mean
really
that's a
gotta
level of
care. You really
dedication.
gotta care to write something out, Will.
It's like you really got to care if you got to find a pen and a piece of paper and a stamp. Like there's just all these different components. All of which by the time you're all done with it, you could have gotten your vaccination. But but I want to switch to kids because I do have two young ones, 5 and 7, and they're currently not eligible to get the vaccine, although they just started school. They're like in their second week of school now, and I had a lot of concern about sending them back. I mean, like my day job, I work in the safety field, so like I get paid to be paranoid, and I was really just naturally paranoid for them to go back. I'm like, I don't know if the teachers are vaccinated. I don't know like what they don't report like the vaccination rates. Like at least the county populates all the positives every single day, which is great because I check it every day and I'm counting. I'm like, okay, they had 17 at school district wide. My school's not in there. but how when can we expect there to be a vaccine for kids under, well, I think was it 12 now or something?
Yeah. So right now we have an approved vaccine for kids 12 and over. They have had ongoing clinical trials for younger age groups for the last few months. We do anticipate, I mean, Pfizer in particular has said that they plan to submit their data for the 5 to 11 age group sometime in September. So, I think it's possible, but possible that end of September, early October. It may be a little bit longer before the FDA does their thorough review of that data and then comes to a conclusion. Everything that, at least that Pfizer has been reporting to date, is that their data from their 5 to 11-year-old trials looks really good. The reason it's taken longer is because as they step down in age groups, they've got to actually use different doses and find the optimal dose at each phase. So right now, the dosing that they've been using for 5 to 11-year-olds is about a third of the adult dose that they use for 12 and up. And then the trials for kids under 5 are going to use even smaller doses, and those likely won't be available maybe till the end of 21, maybe early 2022. But I do think, probably sometime in the next month or two, we should have an approved vaccine for 5 to 11-year-olds, which will be a game changer for what's going on in schools right now.
Yeah.
You want me to talk a little bit about just like the dynamics of what parents and teachers are
Yes,
all.
please do.
My wife is an elementary school teacher. She teaches kindergarten in the Richmond Public Schools here. And, the school system really in March of 2020, and then all of this last school year had been entirely virtual. And as a kindergarten teacher, I think that was really challenging for her. She very much understood, the anxiety that parents were feeling, but on the flip side, like trying to engage 15 to 18 kindergartners 100% through the screen when they had all kinds of distractions on the other ends, siblings in the room, a TV that was way more exciting than school. So, I think that her classroom is just a microcosm of what was a much bigger impact of virtual learning for kids. And I think there were some big takeaways. One, virtual learning is not as good as in-person learning, and the academic progress that kids made who were fully virtual was significantly less. So there was an academic component, but I would say almost as or more important was like the social and developmental components of what kids were missing from having interaction with peers and with adults that they could trust. And that had huge impacts on mental health, behavioral health. We had seen some of the highest rates of suicide attempts and of depression and anxiety among school-age children that we have really ever. And I don't think it's over, right? I think that this really, the whole pandemic exacerbated a lot of that for our adolescents and younger school-age population. So as I mentioned, I'm a pediatric hospitalist, and I maybe once a month or so will work an overnight shift at the hospital. And last winter I was working a shift, and on the floor I had 6 kids, 2 of whom were teenagers who had attempted suicide. That same night, there were 5 more kids in the emergency room who had all tried to take their own life, who were all waiting bed placement at a psychiatric facility. And the reason they were waiting is because all of the adolescent psych facilities in the state were full. And so, there was just this, like, talking to all of the nurses and all of the ER staff, they just never seen anything like it, right? There really was this very, anecdotal in this case, but very real sense of this is impacting kids in a different way. And I still see it. Even, as I've worked some recent shifts, kids who are really struggling with having been out of school, now entering back into school. So all that to say that there are impacts beyond COVID that really have taken its toll on kids who have had to school virtually, and not to mention all the impacts that then radiate out to the family. And as we're making decisions about in-person versus virtual schooling, I think we've got to figure out, how do we actually accurately weigh the risk? Like, what is the risk of kids actually getting COVID versus kids being out of school and having all the other potential consequences?
Yeah.
And that was a much easier question to answer a few months ago before the Delta variant. And the Delta variant has certainly brought in some new variables that we're still trying to really figure out.
Yeah. And I'm curious on, ever since the beginning of the pandemic, we were told that kids seem to have a much lower, either rate of infection or whatnot. And I'm curious if you know why. One of the things I know that I followed really closely here in Virginia was it was the case. I think it's like the multi-inflammatory syndrome C or something like that. so why are kids like less likely to have it so bad?
Yeah, I think the biggest theory of why kids were not affected as severely with COVID was the receptor that the virus, when it enters your body, the receptor in your cells that it grabs onto, it's called an ACE receptor. Kids just don't have as high numbers of those ACE receptors, and therefore weren't seeing as much of the impact of the virus in your body. So that was one of the prevailing theories. And then on the flip side, kids don't breathe out as much in terms of volume of respiratory droplets. When they cough, it doesn't go as far as when you're an adult. And so they were transmitting less as well. And by and large, that's been true. Kids have really not had anywhere near the seriousness of disease that adults have. Their hospitalization rates have just been a tiny fraction of what they have been for other age ranges. And then there is this kind of rare syndrome, the multisystem inflammatory syndrome in children, MSIC, that not really significant, but somewhere between. I haven't looked at the numbers recently, but at some point it was about 1,000 cases nationally. It's probably more than that now, but causing this kind of weird array of symptoms where your immune system was responding by ramping up your inflammatory response to the virus. So that, wasn't insignificant, but by and large, kids responded very well to treatment and made full recoveries. There obviously is a fraction of kids who have had some long-standing symptoms, just like there are adults who have this long-haul COVID syndrome. So there's a lot we're still learning about this, but I think the take-home is that kids have, and Delta variant may again introduce some new variables, but kids have by and large had much less severe disease and not had very severe consequences from COVID.
Got it. So I guess if that being the case, like why would a parent vaccinate their kids. So I know, like, I'm going to vaccinate my kids because people like you tell me I should vaccinate my kids, and I have no reason to not trust you. So like, but there probably inevitably will be people that won't trust what they hear on the news or hear from folks like you. So why should I vaccinate my child if their risk of COVID is even less than mine as a vaccinated adult?
Yeah, so a couple reasons. One, because just because the risk of COVID in children is incredibly low, it's not zero. And so we have lost about 350 children, 0 to 18, to COVID nationally. That is a good bit higher than we have experienced with flu in past years. A heavy flu season, probably H1N1, and maybe there was one other flu season, 2019, where we lost the upwards of 200 children in a given year. So, more of an impact that we've seen with COVID. Largely, that impact has been in kids who do have more severe underlying conditions, and so some of the same things that put you at risk as an adult, we're also seeing that play out in kids. So that would be one reason, is just to protect your child from those rare severe consequences. The other reason is that children are big spreaders. Even though they don't cough as much and have as much propulsion of their respiratory droplets, they hang out in close proximity to one another. And so kids have certainly contributed heavily to the spread of disease in different settings. And so that would be the other reason, as we're trying to really limit community spread, getting as many people vaccinated as possible both protects severe consequences and limits the transmission.
Like, what about masks? So one of the things I hear a lot is, putting masks on children is akin to child abuse. I mean, are there any, studies, or is there any argument for why we shouldn't have kids in masks?
We've certainly heard a lot of arguments, that a mask increases your amount of carbon dioxide inhalation, that you're reintroducing your own bacteria. There are a lot of things that people have proposed. There have been no credible studies that show negative impacts of kids wearing masks. And, adults in the medical profession wear masks all day, every day in the OR, as an example. And what we've seen, as many schools have gone back and had mask requirements for kids, is that kids do fine. It's the adults that have an issue with it, but kids really, for the most part, keep a mask on with no problem. Sometimes they'll need a little bit reminding, particularly early on, but yeah, it's been way less of an issue in real life than I think we've made it out to be in sort of the public conversation.
Yeah. I always feel kind of bad because after I got my vaccination, at least during that time, we were allowed to go into public places without a mask on, but like we would still have our kids wear masks, So my kids always were really good about making me feel bad. They're like, "Where's your mask, Dad?" And I'm like, well, I don't really have to because I got a vaccination, but I'll just put it on anyways. like, geez, like my kids are schooling me now on mask use. Like, geez, don't be a mask hole. Geez, now, no, how concerned should we be about, like the Lambda variant, or I think there was something I read earlier today about like a sub Delta variant, like C1-2 or something like that. Any initial concerns, or is it just like we don't really know yet?
Yeah, I do think it's a little bit early to have real conclusions, and everything that's been published, at least about Lambda, has been preprint, which means that it hasn't really been circulated in the scientific community and had that peer review that we really generally look to validate studies. The Lambda variant, I think we are going to hear more about it. It was first identified in Peru back a couple months ago. We had our first case in the United States at the end of July in Houston, Texas. Have not really seen it take over or cause any significant disease here in the United States. And that might just be because, Delta is dominating right now. Delta is, almost 97% of new cases in the US. And so there's not a lot of room for a new variant to take over right now. But there was one concerning study from Belgium, where there was a Lambda outbreak in a nursing home among mostly vaccinated individuals, and there were 7 individuals who were all fully vaccinated who did die as a result of that outbreak. And so, again, more to learn there. Haven't really seen that impact in other parts of the world. It is the dominant strain in Peru right now, over 75%, and then I think either in Brazil or Argentina, one of the South American countries is seeing a lot of the Lambda variant. I think conceptually, all of these things are things that we need to pay attention to. I mean, what we've seen over the last year and a half is you started with the wild type strain of COVID, and then as we have seen unchecked outbreaks in different parts of the world, viruses, biologically are going to try to survive. And so they're mutating, they're finding hosts, they're finding ways to evade the immunity we have, whether that's natural immunity or vaccine mediated immunity. And so they're going to do their job, and we're going to see more and more versions of this new virus, or this virus. And I think until we get to a point where the bulk of the world has either been vaccinated or has had some type of natural immunity, probably through multiple infections, we're not really going to see this slow down.
Got it. So how does Virginia, I guess, rank as far as vaccinations? I mean, are we doing a good job? Can we do better?
Yeah, we can always do better, but I think certainly compared to our neighboring states, where we are doing pretty well. We hit the target last week of getting to 75% of our adults 18 and over with at least 1 dose. So, that was an encouraging step. It was a goal back in June. The president said we want to see at least 70% of American adults with 1 dose by July 4th. We beat that by a couple of weeks in Virginia, and have continued to keep pace. The problem with that is that 1 dose isn't being fully vaccinated. And so while it's a good thing to aspire to, we really need to get as much of the right now eligible population to get fully vaccinated as possible. And in Virginia, we're about 65% there. So again, good progress. We could always do better, and we will continue to work with lots of different communities to really try to lower barriers to vaccination. And some of those are logistical things, like how do we make sure that we're showing up in communities that don't speak English and haven't necessarily been connected or aware of where they can get vaccinated. At this point, it's much more about getting to folks who don't want to be vaccinated. And I think Delta has opened a new door. We've certainly seen an